This is a patient. Her left eye had active choroidal vascularization, as you can see by the fluorescein angiography, and the fundus photograph showing a large area of pigment epithelial detachment. You can see the OCT that shows you here a baseline acuity of 2125 and a central subfield thickness, which is increased as well. And as a result, received aflibercept therapy, again, in a Q monthly dosing fashion for the first 3 months, and then Q 2 months thereafter, for a period of 24 months. Some of the more surprising results from the study were the change in visual acuity and the change in the central subfield thickness over the course of the study. The study found that the mean visual acuity improved by 10.4 letters by the period of 24 months. Now again, these patients had received 3 loading doses and Q2 month injections thereafter, and had a nice response and improvement in visual acuity over baseline. When looking at their OCT, one of the other interesting things was you saw a significant reduction in the retinal thickness of 41 microns by the 24-month period. All of these numbers were statistically significant from baseline, and again showing you that these patients probably were slightly undertreated in our PRN fashion, where they were receiving injections on an as-needed period prior to enrollment in the study, where they got mandated Q2 month injections of aflibercept.
Can you walk us through the changes in visual outcomes in this patient throughout the 2 years of the study?
So this patient presented with a baseline acuity of 2125 or 48 ETDRS letters. You can see on their primary or initial OCT they had subretinal fluid, subretinal hyperreflective material, and intraretinal fluid present on this OCT. And as you can see after the first 3 loading injections, there is a decrease with aflibercept of the subretinal fluid, as well as an improvement of the overall retinal contour. Then the patient was transitioned to Q2 month injections thereafter, and you can see as the Q2 month injections persisted, that subretinal fluid dried up over the course of the study, and by month 18 and month 24, the patient's visual acuity was actually 20/40, with a small residual amount of subretinal fluid present on that scan. Now the patient had achieved 73 letters of visual acuity improvement, which was over a 15-letter improvement over their baseline.
What are the key conclusions of the study overall?
So there are lots of things to be learned from the ASSESS study. First is that it was a prospective, standardized study which was done in a prospective fashion. So we have good data to look at for these patients. These patients were followed very, very closely. The drawback for this study is really the non-randomized clinical study design, and that's by virtue of these patients who were in the study. At this time, there was aflibercept released, and a lot of patients wanted to try the drug, so we enrolled them in the study. And what it really showed you was 2 things. First, we saw a reduction in the retinal thickness and an increase in visual acuity, and these patients were treating on an as-needed fashion when we went to a mandated Q2 month dosing interval with aflibercept. So I would say that the results seen here were either because of the mandated dosing regimen we gave to the patients, or potentially the beneficial effects of aflibercept we saw with these patients, because aflibercept has a little bit of a different mechanism of action than we've seen with the other anti-VEGF inhibitors currently in practice.